I'm so bloated. So I just want to tell y'all, like, I wish I could record some of these conversations that I'm having on the phone with some of these OBGYN doctors. Now, you guys know that I just went to Beaumont the other day. Went to view of them, had a doctor tell me, oh, how would you feel if you walked out of here? How do you knowing that your baby's dying? That was at U of M. So today I called Beaumont because I was supposed, my doctor faxed a paper over to them back, I would say, before Christmas. And they were supposed to get back with me about the paper that he faxed over there. So I called today. So I called today and they were like, I called today and they were like, I'm calling because my doctor faxed you a paper round about Christmas and, trying to figure out where it's at. So now this person that I get on the phone with say, oh, well, we haven't received any paperwork from your doctor. Now, the last time I called, they said they were waiting on the paperwork. But I figured since I went to emergency a few days ago, you know what I'm saying, that they would at least have some type of a little bit of history. You know what I'm saying? Because I talked about a lot of my medical history with the doctor that I seen in emergency at Beaumont. Y'all, this is a horrible mess. And I told them, I said, I'm going to make sure I blast y'all all on my YouTube channel about how, because this lady, when she got on the phone, she was like, well, the doctor's name, who I'm trying to get, his name is Dr. Perry Freeman. He works out of Beaumont. So she's like, well, Dr. Freeman, if you're too high risk. Now this doesn't even make sense what she told me. Listen to me right here. She like, if you're too high risk, then Dr. Freeman is going to refer you to our resident clinic. What? If I'm too high risk, you're going to refer me to student doctors? This is a professional doctor right here. Professional. My doctor, which is my internal medicine doctor, has treated me for the last 5 years. Before I got pregnant, I was struggling with kidney issues and spots on my liver. Now you're going to tell me that this doctor is going to transfer me to a bunch of residents doctors that treat high risk patients? So I said, so basically what you telling me, ma'am, is I don't have the right to pick what doctor I want. She like, at this point, no, you just have to go where the doctor sends you. Do women know this? Do women know that when you get so far along your pregnancy, that these doctors don't want to see you, but they're constantly telling you you need to go have an appointment. You need to go see a doctor because you're high risk. But the doctors that you pick of your choice, that you did your research on and that you like, you can't see because they want you to go to residency doctors. That makes absolutely no sense. Then they're telling me, well, if you don't get a doctor, then you won't have no prenatal care. But if I don't have no prenatal care, about time I do go to the hospital and give birth, I don't have no history of prenatal care. I have marijuana in my system because I'm struggling with a lot of pain, struggling with a lot of anxiety, don't have anyone help me with anything. So I'm using weed as a coping mechanism just to keep my pain tolerance down, also to keep my anxiety down. But when I give birth, y'all gonna want to call CPS on me because y'all gonna say I didn't try to get the proper care. But all this time I've been calling these doctors, asking them, I'm not gonna go see a resident doctor. That's a student doctor. I told y'all fuckers that I already almost lost my 6-year-old. So why would I go back to a residency? They don't like to listen. These doctors don't like to listen. They don't want to be told. They do not listen to their patients at all. They do not. I mean, it's basically crazy. Like, I don't know if it's because of the time of COVID, because when I gave birth to my other two kids, it was, if I went to DMC, y'all, which is Detroit hospitals, if I went to DMC, I could get a doctor with no problem, just like that. But I wonder if it's because I'm in the suburbs, Royal Oak, Beverly Hills, Michigan, Bloomfield Hills. It's because I'm in a hospital with minority of Caucasian people that dealing with an African American person. They want to make us look bad. They want to give us a hard time. They want to make it seem like it's us. Me, I've been trying. I don't want to take a doctor that anybody gave me. I'd rather do my research. I'd rather listen and read the reviews. I'd rather see what other patients have said. Okay, now I see other patients like this doctor, then yes, this is the doctor I want. But I have these other people telling me, oh, you can't see the doctor because they have to look at your files. Well, if I never been to this hospital, how would they look at my files? And I'm just wondering, like, do they treat everybody like this? Because like I said on my other video, if I was a Caucasian married lady with a wealthy husband, or just well off, would these doctors be treating me like this? I don't think so. I don't think so at all. I think it has everything to do with color. I think it has everything to do with insurance. And it's sad, y'all. It's so sad. It's so sad because people that really need help can't even get it. Hold on. It's very dark. And what I'm going through, I'm pretty sure I'm not the only person. And I told them today, I said, I'm going to blast you guys all on my YouTube channel, because how many other women is struggling with this? If you should have the right to pick your doctor, if you don't want to see a resident doctor, I understand students have to get their experiences from somewhere, but they don't have to get it from me. If you are a student doctor, I don't have nothing against student doctors. They got to learn some way, but not off of me. I don't want my third pregnancy being overlooked by a student doctor. And it's like, you don't have no rights, no say so. It's only what they say. Oh, you gotta go here, you gotta go there. Oh, because we don't like this, we're gonna call CPS on you. Oh, you're not taking the pills that we want, so guess what, we're gonna test your system, and if you test positive for this, then your baby's gonna be taken away. This is all bullshit. Not nowhere do we have a say-so in anything. We don't have a say-so on what pills we want to take. Just like I told y'all, I'm really pissed about the other day. And that doctor told me, well, you know what? If you're having some anxiety issues, I can slip you something in your IV. Bitch, because she wanted it. She wanted me to take drugs. But when I deliver my baby and they find out that I have marijuana in my system, they're going to want to take my baby because I wouldn't get on their drugs. This is such a hard thing to go through, a hard thing. It's so stressful trying to just deal with these doctors. Really like drained mentally, to the point where I don't even want no doctor. I mean, how many times do my doctor have to fax you a paper? Seriously. And then you keep saying you didn't get it, you didn't get it, you didn't get it, you didn't get it. Well, guess what, lady? Until I deliver this paper, I'm going to call your office every day to see if you got that paper. I'm so emotionally drained. Just ready for this whole thing to be over with. Don't think I would want to ever deliver a baby in these times, because you don't even get to get a doctor. They have to pick your doctor. They have to pick whether they want you to see student, residents. I'm all drained out. I really am. I'm just going to keep continuing to record my pregnancy. So if I ever come in any bumps in the road, so far I haven't, thank you Jesus, it's only because of God. No matter how wretched my mouth is, I know where my blessings come from. Just because I'm not in order with him doesn't mean he's not in order with me. And this is where my blessings come from. And honestly, I feel like if God has brought me this far, he will not leave me. Didn't I understand when I say this, when I say God is in charge of life and death. So if he gave me life, he will be the reason he will take life. I think that we need to be supervised by the ignorant doctors on this earth to get through births. But nowhere in the world am I relying on man to be responsible for the birth of my child. My mom told me a long time ago, you're not in charge of life and death. And for a long time it took me a little minute to realize what she was basically saying. And what she was saying is, if someone is born and someone dies, it's not our choice. It was already written in the books that was our sunset date and our expiration date. God forbid anything happen and I'm not able to carry it out. It's gonna take the Lord to put like a whole lot of hands on me, because I know he giveth and I know he taketh. And I know I'm not the only woman that will go through that, but I give women that went through miscarriage, I give them the most utmost respect, because I actually really can't even see how strong they could be to let the baby that they carry for 9 months and just to bring it in this world and it don't make it. Oh, the hurt behind that. Oh man, I don't see nothing on this earth hurting worse than that right there. Or somebody taking your baby from you, carry this baby for 9 months, and then here you got these dumbass CPS workers talking about something. You can't keep the baby because of their dumbass rules that some educated idiot taught them. So they want to brush it off on you. I can't see going through that. Oh man, that would just be a heartache. I wouldn't wish nobody to have a baby during this time. You can't even have your support person. You can't even if you had a baby right now and it was your first baby and you got to see the ultrasounds, the dad can't even come in the doctor's office with you to see the ultrasounds. Everything is top secret. Like, why can't my kid's father see an ultrasound video? Why can't he hear the heartbeat? Because of COVID? Neither one of us got COVID. So why can't we share that moment that you will never get again? Oh, yeah, I just don't understand. I just don't understand. I'm so tired of the system. Seriously, I'm just tired. I'm exhausted from calling and talking to these doctors. Fucking exhausted. This shit is terrible.